Welcome to the American Med Spa Association podcast, Medical Spa Insider. This week, AmSpa President and CSO Cathy Christensen is speaking with Coverwell's Chief Marketing Officer, Kandis Hughes, and Coverwell's co-founder, Pat Tighe.
Hi, my name is Cathy Christensen. I'm the President and CSO of the American Med Spa Association, and I'm really excited today to be doing a podcast with our friends at Coverwell. We have Kandis Hughes with us, as well as Pat Tighe. Pat Tighe is a co-founder of Coverwell, and Kandis is the Chief Marketing Officer. And today we're going to be talking a lot about credibility for your business, making sure that you're running in a safe and credible way, and then also just handling adverse effects with your patients in a proper way as well. But before we get there, I would love for us to talk a little bit more about these two incredible professionals in our industry, as well as Coverwell. It's an interesting company that is not necessarily insurance, but it's in the same vein, and I want to talk about that a little bit as well. So why don't we start out? Pat, tell us a little bit about yourself. You are the co-founder of Coverwell, correct?
Yes, thank you very much. We love AmSpa. Thank you for having us. This has been like a 12-year journey for myself and my co-founder. Myself and Dr. Daniel Kapp, who's a board-certified plastic surgeon, founded the company. And back in 2012, my wife went to a med spa to get some permanent lipstick. And, you know, she did her research and she read the Google reviews and the Yelp reviews. And she figured out who she was comfortable with. And she got some permanent lipstick, some like lip tattooing. And unfortunately, she was a statistic, right? My partner, Dan, when he preps people on their informed consent and their waiver, he says, listen, it's 1 in 10,000 people have a complication, but really for you, it's 50-50. It's either going to happen or it's not going to happen. So unfortunately for my wife, it happened. And then as so many people, when it happened, she called the provider and the med spa, and she left a message at the reception desk, and they never got back to us. Then we called again and we called again, and we got ghosted. So, you know, we live in Florida. The med spa was in New York City because she wanted to go to the best one. You know, I'm sure everybody's familiar with that feeling. You always feel like you're going to the best possible practitioner, and you should have that kind of faith and trust in your practitioner. And so we came back to Florida, and I had to go see my friend Dan, who's now my co-founder at Coverwell, and he's the plastic surgeon. He said, yeah, I can fix this. I can mitigate the damages. So he did some laser therapy and a little bit of steroid injections. And then he gave me a bill. And I was like, well, here's my insurance card, my health insurance. And he said, no, this is kind of the fruit of the poison tree. So your wife signed a waiver and informed consent because this was an elective aesthetic procedure. She didn't need to have this happen. So health insurance doesn't need to pay for this. Because it was aesthetic and elective, you're on your own. So when you sign these waivers and the informed consent, it's not just a warning that these things could happen to you, but it's also a warning that you're out on your own in a desert island if something happens to fix your damages. Because when you sign that waiver, you're telling the spa, I understand these things could happen to me, and I understand if they happen to me, I can't sue you. I'm not going to come after you. So that's what we were left with, and it cost us a few $1,000s to fix my wife's lips. Yeah. And it got me to thinking, and it got my partner, Dan Kapp, to think, like, why isn't there some type of risk management or insurance attached to these waivers and informed consents? And that's where it came about. That was the spark that made Coverwell. And just, if anyone's unfamiliar with us, we're a very minimally costing service. We're called an extended services contract because we're not insurance. We're not a warranty, but we operate very similar to them. We can only give money if someone has a complication or an adverse reaction. And then that money's given quickly, and it's given to help ratify and fix the situation right away. But that's enough of me talking. I'm sorry.
No, I'm glad you clarified that. And I want to definitely come back to it. In my mind, and please correct me if I'm wrong, but Is it similar in a way to veterinary insurance, where you're paying for a type of coverage based on the claim amount, based on whether it's in providership with you? Is that how it works? I want to dig into that. Before we get to it, though, Kandis, I want to kind of chat with you. Kandis Hughes is the Chief Marketing Officer for Coverwell. Pat, it doesn't seem like you could have found a better person. She's an incredible woman. She has worked alongside Fortune 500 and Inc. 5000 companies. She's contributed to building, leading, and growing the commercial success of numerous organizations, overseeing business portfolios exceeding $2 billion, and has done an incredible job of scaling businesses across a diverse range of industries, from startups to turnarounds. And now she is here with you at Coverwell. Kandis, tell us a little bit about yourself so we can get to know you a little bit better.
You did a fabulous job. In addition to all of those things, what is so important about, myself, and again, most importantly, what attracted me to Coverwell and to everything Patch has built alongside that of his co-founder, Dan, is that this is a business that's in it through a trifecta fold of helping people and giving back. It's providing a solution that these small to medium-sized or even larger business owners, whether you're in the aesthetic clinic space, whether you are a med spa, whether you're, we can even go into dental, IV therapy. We're talking about the peptides now too. There just is not this solution. It's never been presented, and no one else offers this safety net. And I can certainly resonate with having some non-invasive procedures, having a very large majority of my inner circle who also, takes advantage of them. And I will tell you, the majority of individuals, luckily not that of myself, but they have had adverse events to some degree and didn't know that that's exactly what it was. So being able to not just be a consumer who does leverage the space, but then also see how it can really, quite frankly, bring trauma to individuals for the first time getting certain treatments. And whether it's the practitioner's fault or not, it's just, let's say, an allergic reaction that happens to getting fake eyelashes on. This happens to so many people. And while it's not spoken about enough in the industry, it's going to become more and more relevant. You're seeing the statistics begin to pop up. Regulations are going to be coming. So just to be a part of something that Pat has so much passion for, his wife, and really the entire Coverwell team, to be a part of that has been a blessing for myself, because we get to help patients, we get to help protect the industry and space, preserve the credibility, and also, most importantly, for the business owners, right? Because being able to give back and help businesses scale and grow has always been a very large passion of mine. And so to be able to offer it through a different lens has just been very rewarding.
That's amazing. And as we know, these things happen, right? It's one of the things, we have the Academy for Injection Anatomy, which is a cadaver-based anatomy course run by Dr. Chris Zurich. And one of my favorite parts of that is when he and his esteemed faculty are doing the complications panel. And he always starts it out by saying, my most recent complication was X. And Dr. Stephen Weiner is on that panel, and Sarah Safa is on that panel, and George Baxter Holder, Hermine Warren. They're the best in the industry, and every single one of them has, despite their incredible hours of training and practicing, experienced something happening. So it does happen. And I don't want to say as scary for the practitioner as it is for the patient, but it's not something anybody loves to run into. So I'm curious about proactive measures that practitioners can take in order to start kind of figuring out a way to avoid these adverse things. They do happen, but how do you avoid them? And then if they do happen, what's the best way to handle them? Do you guys have any advice on that?
Oh, it's excellent topic. Best practices are always the best practices, right? So AmSpa, you guys provide a wonderful packet on like how to do standard of care, prior history, prior to the performing of the procedure, a fully informed consent, a full knowing waiver. It's so important for the med spas to do it the same way every time, and to do it, patiently and slowly, right? It's got to be deliberate and the same. And then you're going to have the fewest amount of adverse reactions. I don't even call them complications anymore, because something I learned at AmSpa, I was standing outside of one of the continuing education panels about complications. There was no room inside the auditorium. There were probably 300 people inside. And it was like 60 minutes just about complications. And 100% of the people came out and said they don't have complications at their practices. And
What
I
do
said,
they have?
adverse reactions
Adverse reactions.
or adverse events.
Mm-hmm.
And that's, when I'm not the CEO and co-founder of Coverwell, I'm a plaintiff's attorney. I'm a trial lawyer. So words matter.
Mm-hmm.
And what I understood, what that taught me, was that in the med spa world, complication means you did something wrong. Where adverse reaction, adverse event is really kind of a safer way to have the conversation, because everybody involved in that conversation understands nobody did anything wrong. And that's really where the term complication should be. Complication should be nobody did anything wrong. Because the truth of the matter is, when an adverse event happens and one of your AmSpa members, they're probably doing everything correctly, everything's clean, it's the proper dosage, it's the proper Botox, it's not counterfeit, everything's proper, and it still happens. Like your panel of those wonderful doctors and practitioners, if they're honest, they're going to tell you that they have the complications and that they happen. And I think the best practice is what AmSpa is teaching and kind of singing from the mountaintops. Do everything the right way, get everybody educated, communicate with the guest or the patient, however they refer to them. And then, like you said before, when an adverse reaction happens, communicate with them. Don't ghost them. Embrace them even closer and talk them through what happened. Because I've never seen a whole industry where everybody is so, and I mean this in the best possible way, concerned with everybody's health and concerned with everybody having the best possible experience. So, that is truly how I define the med spa world. But then when one of these things happen, everybody pulls back, and that's when you really should lean in.
Would you say, had that happened to your wife and yourself, had you gotten immediate communication, would that have kind of changed the way you handled it, or given you a little bit of comfort in what you were dealing with?
Wholeheartedly.
Yeah.
If my wife had gotten called back and they said, just come in, let us examine you, I can tell you without a doubt, we would have had a better opinion of that med spa, and we probably would have had to done the same thing that we ended up doing in terms of mitigating our damages, but we wouldn't have felt like we were ignored and we were unimportant.
Exactly. Okay, very good. No, and I think you're absolutely right. That's one thing that communication and kindness. I always share this story. I know I've shared this story before on the podcast, but when we were actually talking to malpractice attorneys, their number one tip was to be kind and to be nice when you're talking to people. It may still, who knows, end up in a lawsuit, but 9 times out of 10, if you confront it and you're nice about it and you're not a jerk, there's hope that, everything can turn out amicably, then as opposed to not so much. So
I would also love to add something to this conversation, because going back to personalizing the experience. Every single one of us are individual humans. Our DNAs are made up different ways. We're going to react and respond to things that most oftentimes cannot be predicted. And so when you asked about how to proactively make recommendations as to how do people, to the best of their ability, treat each patient through genuine interest and connection of getting to know them rather than that of a transaction, it's so important. And I'm just speaking from experience because I live from coast to coast. So we're in Scottsdale, Arizona, and we're in, New Jersey, New York. So I've needed to seek out different, clinics, med spas, whatever it might be for my treatments. And in doing so, it is clear as day. And unfortunately, about 80% of, let's just say, the 9 that I've, sussed out, if you will, I just felt like another transaction walking through the door. Just another few needle pokes, just another this, another that, versus getting to know me, truly understanding what my medical history is, what procedures have I gotten done in the past, right? What are my goals? What do I hope is going to be the outcome for me that's going to fill whatever I feel like isn't there, where I'm going to look in the mirror and say, okay, the decision I made worked, and the person I went to, who I instilled my trust in, I'm seeing things come to fruition the way I wanted them to play out. So I would say identifying patient goals, educating them too, because I found myself asking so many more questions just in order to seek what I would think is the basic information I should be educated and coached around prior to the actual procedure or treatment happening. And so it was almost like I felt like I was on a blind date, needing to ask 101 questions with all of these providers, and bless their hearts, they were all fantastic. And that's not to talk negatively, but it created doubt in my mind. Like, why am I the one asking these questions versus them being the one to educate me? And then lastly, just setting the right expectations. In my past, I've worked with dental, I've worked with aesthetic clinics, hundreds of businesses, providers, front office staff, business owners alike. And there's always been a bit of digging heels into the ground when it comes to setting expectations and what could happen that maybe isn't ideal. Because 9 out of the 10 times of the places I went to, that wasn't talked about and I had to ask, it did create doubt. And I will tell you, it was of everyone I saw, there was one in Scottsdale, Arizona, and one in New York who took the liberty of telling me, now this could happen. We need to be upfront and honest, although, here's how we're going to have our, post-procedure follow-up, this, that, and the other, to give me a sense of comfort knowing that they would be there in the situation that maybe something like that happened, regardless of the small percentage. So
would you say, and help me understand, are you signing the consent, but you're just not having the conversation? Is that correct? Or you're not doing, like in the other however many 7 that you didn't have this conversation with, was there a consent form, but the conversation wasn't had and it's just in a stack of other papers you're signing? Or how would you recommend that our practitioners move forward and make sure that they're able to have that conversation with a degree of confidence? Because it sounds like it might just be something you don't want to talk about because it can lead to maybe questions you're unable to answer, or an uncomfortable situation that might prolong the treatment or what have you. What's your advice on kind of breaking down those barriers a little bit?
Yeah. So traditionally, and again, I'm just speaking through my experiences,
right,
coming, checking in at the front office, signing the consent and form waiver there, which that's absolutely okay. I do take that responsibility upon someone of myself to read through the fine print, ask any questions that I may have, etc. It's when I'm actually in the chair and there's different types of fillers, there's different types of, Botox, all those types of things in which prior to me, I didn't do a whole lot of research other than similar to Pat's wife, Sarah. I looked at reviews. I knew what I wanted to look like, and that's the level of readiness I went in with. And so from a patient's perspective, it would be just genuinely be interested and curious, ask good questions, understand the patient history, get to know them. Like, how many, have I had a procedure before? If so, how many times? And how long have you been in the space and working on it? What have you seen? And if it, speaking about adverse events that could happen, talk about it. Don't hide behind a curtain, because, also, for unfortunate scenarios where I've had family members or friends who have encountered those things, they would then call the med spa and they'd say, "Oh, this is normal," or then they just, what have we been calling it, Pat? They just go, they ghost them. They just go dark. And so it's, this interesting world of take ownership, and it's not always, and more times than not, it's not the provider. It's simply the patient. It's the way their bodies are reacting, responding to something in which their medical history didn't otherwise tell them. And I know, Pat, you have your individual story too, which is another thing that makes me just as equally passionate about all of this stuff, because you went through that same thing yourself, in addition to that as Sarah. So.
Hey folks, it's Alex Tiersch. When it comes to injecting in the face, safety is more than skin deep. One wrong move could cause serious injury, hurt your reputation, and possibly endanger your business. That is why AmSpa partnered with the Academy for Injection Anatomy to create the AIA Advanced Cadaver Course, the most thorough and advanced facial anatomy course in the industry. Created and taught by renowned board-certified plastic surgeon Dr. Chris Surik, one of the foremost facial anatomists in the world, along with his hand-chosen faculty of the most experienced injectors in the industry. Students experience firsthand and close-up the anatomy of the face so that they can inject safely and confidently. Unlike other cadaver courses with large groups or limited access, the AIA Advanced Cadaver Course provides small group instruction with a high faculty-to-student ratio and a limit of 4 students per cadaver specimen. Everyone who attends gets a chance to inject real product and then dissect cross-sectionally to see how close they came to vessels and other important structures of the face. This hands-on cadaver lab follows a full day of instruction on facial anatomy from our world-renowned faculty, including discussions of complication management, rheology, and an introduction to the use of ultrasound in your practice by Dr. Steve Weiner, one of the pioneers of using ultrasound as facial injections. At this 2-day course, students learn how to avoid common danger zones, how dermal fillers behave, and the best places to place product for safe, outstanding results. More than 3,000 aesthetic injectors have improved the safety and efficacy of their injection techniques with the AIA Advanced Cadaver Course. Now it's your turn. Visit americanmedspa.org/AIA Advanced. Start your journey to safer injecting today. The AIA Cadaver Course will be in New York City on September 20th, Nashville on October 18th, and finally in Orlando on November 8th. See you there.
Yeah, I'd love to get into that. Quickly, though, I think it's important to note kind of at this point in the conversation that though these things do happen, it's medical spas, medical aesthetics is an overwhelmingly safe industry. But they do still happen. And when they do, there's no avoiding it. Just all medicine has adverse reactions, but it's all in how you handle it. It's all in how you prepare. It's all about risk management. So I think it's really important to talk about these things, but also to understand that they should be few and far between, and usually, absolutely, in this industry, they are. This is not the rule; these are the exceptions. Go ahead.
Just to piggyback on that, it's overwhelmingly safe, and my wife had that adverse reaction in 2012. It's now almost 2025. She's been back to the spa. She's, we're not afraid of the spa treatments. It's just the unlucky lottery ticket, really.
No.
And what Kandis said, you start the rapport in the room when the treatment happens, but then afterwards, there are, and I know AmSpa has these guides where a follow-up call, hey, how are you feeling? 12 hours after, 24 hours after, depending upon the procedure that they had done. just to check in and to make them feel like an important human being. Like, wow, you just stuck my face with a needle 55 times. Thank you for calling me 12 hours later. Yeah, my face hurts. It's full of little tiny wounds that are healing, and then I'm going to look great. But part of the education or the interaction with the customer and the patient is to A, inform them, also B, prove how knowledgeable the provider is and show how much you know about what you're doing, and then treat them like a human being, treat them the way you would want to be treated. And even if there is a complication, everyone's going to get along and you're going to together work your way through the complication. But the reason I started speaking is, you're right, it's overwhelmingly safe and there are not a lot of complications. We are not saying that med spa services are unsafe. All we're saying is when something happens, there's a gap, there's a hole. And that's a perfect segue for me to tell you about what happened to me almost a year ago. So
by the way, you two have drawn that unlucky lottery ticket.
Yes.
You and your wife. I'm so sorry to say, but it seems like you've definitely been through it.
It was last year was a rough year. So September 15th of 2023, let me harken back. In May of 2023, prior to the AmSpa convention in Las Vegas, I wanted to lose some weight. So I went to a hormone replacement therapy HRT clinic, and I got some semaglutide compounded at a pharmacy. They mailed it to me, and I took it as prescribed, and they gave me this great Excel spreadsheet on how to take it, when to take it. I followed it religiously, and I had great results, amazing results. I think I lost 25 pounds.
Oh, wow.
And felt great. Everything was great. And went to the AmSpa convention in May in Las Vegas, had a great time, saw everybody. And then later on that summer, I stopped taking the semaglutide because I reached my goal weight. But as it happens, I'm very common, like every other person, I started gaining the weight back. And I got a little too smart for myself. And I went to one of the online, advertisers on television, and I got prescription Ozempic in the pen, and my health insurance paid for the Ozempic because I had the BMI was right and it was medically necessary. But it wasn't as hands-on as the HRT therapy place. Didn't give me an Excel spreadsheet. Didn't tell me. It just said basically turn this knob, give yourself a shot Sunday nights. And what I didn't know was that I had diverticulitis. And I'd never been diagnosed with it. And what I've come to find out is that if you have diverticulitis, you really shouldn't get on semaglutide because they do the same thing. They both slow down your gastrointestinal tract. And then what happened was my intestines burst. I perforated in 3 positions, 3 spots.
Oh my goodness.
And I almost went septic and I almost died. I mean, really, truthfully. I was in the hospital for 9 days, and the doctor was lovely, saved my life. He said, I think you're strong enough. The antibiotics, the IV antibiotics should clean up this infection. And then when it's cleaned up, we'll go in and we'll do a robotic surgery and we'll resect your intestines, take out the diseased portion and sew it together. And that's what we did. And what he said to me later on after I came through it was that another doctor would have done emergency surgery on me. And emergency surgery would have meant they cut me open from my throat down to below my belly button. And they go in and they take all the sick part of the intestine out right away. And they put you on a colostomy bag, and you may never get off it for the rest of your life. And I was 53 years old. I hopefully have a lot of living to do.
Yes.
And, thankfully, it all worked out just the way the doctor wanted it to. So I ended up having surgery before Thanksgiving, and they resected 14 inches of my intestines. And I got a full clean bill of health, and I don't have any diverticulitis.
Oh, that's good.
What it's done inside of Coverwell is we decided that we're going to provide this coverage for peptides. Because had I had Coverwell for the peptide, it would have given me some help with the finances. Like one of the things that we do is we'll pay for 10 days of ICU therapy. If you're in the ICU, we pay 10 days of hospital stay. we'll pay for 10 days of hyperbaric treatment. We'll pay for a helicopter ambulance or a regular ambulance, specialist, all sorts of stuff. It's all in the plan. But of course, I didn't buy my own coverage at the time because we weren't offering it on peptides at the time. But now we do offer it on the peptides. And the same thing with the peptides as with the aesthetic stuff. Some people don't have the high BMI that they actually medically need to have these peptides. So they pay cash for them, and then they have to sign an informed consent and a waiver to make them aware of a possible adverse event or reaction. And, that's why we expanded I see, and I think Kandis agrees with me, but we see these peptides are going to be in every med spa, probably inside of 12 months. And we also think they're going to be in every hospital and in every orthopedic. You're going to see orthopedic institutes, orthopedic services having it because, if you go to the doctor and you have a herniated disc in your back, if they can help you to lose 20 pounds inside of 8 weeks, your back's going to feel better. And then they may not have to do like a spinal surgery on you. So that's my own, I'm sad to say, my own personal story of having that unlucky lottery ticket. But
I'm
hopefully
so glad that it all worked out. I'm so glad you're here with us to talk with us a little bit about, and sharing your story means a lot. I can't even imagine how terrifying.
It was scary. We have 4 kids. My youngest last year was 5. My oldest are 15.
Oh,
and it was scary times. It really was. But I'm back 100%. I have no restrictions. Luckily, right? It was catastrophic, but complete 100% curable, and I'm 100% cured. And I like I keep thinking about what Kandis said. We do Coverwell. We want everybody in this med spa space in that transaction to be protected. We want to be a safe net for everybody involved. The patient who unfortunately wins that unlucky lottery ticket, and the provider who did the services on them, and the spa owner, everybody. So we want everybody to be united into helping the person with the adverse reaction to get better. And that's what we're presenting. And that's we want to elevate, I hate to say it, but AmSpa, the mid-level, did I say that out loud? The mid-levels, right? It's no longer going to be mid-levels and board certified. It's going to be the whole med spa space is really the whole med spa space. And we can't think that way anymore. Everybody's got to be treated, because all the customers the customers are all the same, whether they go into a board certified plastic or they go into a mid-level. They want to have the best possible outcome, and they want to be treated with respect and dignity.
absolutely. So I'm curious, help me understand exactly how, without making it into an infomercial. Of course, it's never what we want to do, but I'm curious about how the program works. I assume it's a patient adopted program, but tell me more.
Initially we had it as an add-on in the spas, but what we've come to learn is that it needs to be an embedded, almost like a warranty product, right? Almost like the Apple Care you get on your iPhone when you buy it. Everybody, 100% of the time when you buy an iPhone, you get Apple Care. It's the Apple Care Plus that you have the option of buying in addition to Apple Care. But when you go to the med spa, you're not getting that first Apple Care, and you're not getting the Apple Care Plus. You're just getting the procedure, and you're being let out of the spa on your own. So in our best studios, they have 100% compliance, where people who are the customers of the med spa, they basically tack on Coverwell onto every procedure, every service that's done, and the cost is 5%, and then everybody gets it. And the benefit to the spa, where everybody purchases it, everybody gets it, is that if somebody calls up the spa, the person answering the phone doesn't have to pull a file and see if they bought Coverwell or not, and then think, oh, I hope they bought it because they had a complication. This way, everybody buys it, everybody's covered. If somebody calls and they have an adverse reaction, that front desk person can send them to Coverwell, and we're going to embrace that client. We're going to say, we're so sorry this happened to you. Let's get you back on the road to feeling better. And sometimes it's as simple as educating them about, what's an adverse reaction and to what is just bruising or a little bit of swelling. Because look, we say minimally invasive. They're not non-invasive. They are invasive. They're minimally invasive, but they're going to cause a red mark. You're going to get irritation before your body heals and you look wonderful. And sometimes that's all the patient needs to hear. They just need to know, yeah, what's happening with you is exactly how it's supposed to happen. But if they call the spa and they're angered or they're upset or they're a little hysterical and they're complaining about redness on their face, the spa might ghost them. And we want to prevent that, because when you lose a client, it costs so much money. It's more than just the one client. It's all the referrals from that client and all the people that client knows in your practice already. So if a person has a complication and the spa doesn't treat them correctly and embrace them, they could lose a lot of patients and a lot of money over that. And nobody wants that. This is a non-negligent, this is a no-fault thing. Something happens because it's just unlucky. There's nothing that could have been done to prevent any of this.
But that being said, and I'm sorry, Kandis, go ahead.
Oh, I just wanted to clarify the percentage. It's a percentage of the treatment, which Pat did say the 5%. It's a pass-through to the patient. So it's not the actual medical clinic, spa, whatever may have you incurring the cost. It's similar to that of a tax on something that you buy. And I can honestly say, speaking as a patient myself, I wouldn't even think twice if I knew that was part of the treatment plan. I'd be more appreciative of saying thank you than I would questioning anything about it. And to Pat's point, that is what we see. It goes on the invoice. It's on each one of your forms that the patients are signing. It's very simple, and we wanted it that way so that everything is easy. And it's, not this entire introduction or big thing that folks need to go through.
Are there limitations for what spas can work with you for this, or what kinds of patients?
We have a floor. We don't cover manicures or pedicures. And then we go up to general anesthesia. If someone's going under general anesthesia, we're not going to cover whatever it's done under general anesthesia. But so basically it's IPL peeling, laser peeling, we'll do that. We cover laser hair removal. We cover the peptides, obviously Botox, any kind of injections, Juvederm, cool sculpting, M-sculpting, microdermabrasion, eyelashes,
IV therapy.
And you work with solo practitioners as well as chains and franchises and things like that as well?
Yeah, absolutely. We work with solos, chains, sure, everybody. If they're a member of AmSpa, we'll probably work with them. Yeah.
Well, I love to hear that. And of course, our members, we love our members. They're always kind of the hardest workers in this industry, and they work really hard at risk management. And that's a big part of this too. Adverse events do happen. But before our time is up, I would love to hear kind of your tick list for risk management. What are the things that people should be doing? I know we've kind of talked extensively about the importance of A, communication, and B, quality communication, quick communication, follow-up. What other risk management practices would you recommend for folks to do so that it doesn't really get to this? Or if it is something that's severe, hopefully they have Coverwell already, but what are those things that folks can do to make sure that they're practicing as safely as they possibly can for their patients?
That's a great question. I know AmSpa offers a risk assessment. I would definitely contact AmSpa and have one of those risk assessments done, and then just check out what kind of different coverages you have and best practices. I feel like I'm preaching to the choir a little bit, because if you're a member of AmSpa, you probably have this stuff already. You've probably gone through this already. But really,
well, we have listeners that aren't members too. So.
Okay, all right. Forgive me. Become members, and then you'll get access to all this stuff. But the truth is, you want to have your eyes wide open. And like when we first got into this space and we were first introducing Coverwell to people, they were like, whoa, you're bringing too much attention to the waiver and the informed consent. And my response to them was, I hope I am, because you need to give that the proper attention and spotlight so that all your patients and customers understand what is at risk, because 99.5 times out of 100, nothing's going to happen. So why are you worried about talking about it? And then the time it does happen, hey, remember we had this conversation, we said it was a possibility. So no one's surprised, and no one is upset because they weren't warned, or they weren't told what potentially could happen. But I think it just comes down to like, that old school book, everything I learned, I needed to know it in everything I needed to know, I learned in kindergarten. Just treat people with respect, talk to them. Your med mal attorney said it best. If a doctor's a jerk, he's going to get sued. If the doctor's nice and treats someone, like a person and values them, they're not going to get sued. When you treat people like they want to be treated, you're going to have a good result. I think that's my best risk assessment or risk analysis for you is treat people the way you'd want to be treated.
Yeah. And I would say to complement everything that Pat said, because it is such a massive part of all of this, and looking at our most successful practices and through my past, whether it's been me as a patient going in and getting serviced, or through helping scale and grow these different aesthetic businesses, always making sure you're qualifying the practitioners you're bringing in, right? And so making sure they have their credentialing, what training and certification are they coming with the space growing as quickly as it is, and it's evolving so rapidly. Things are changing and regulations are there. They will become more stringent though. So identify your standard, I would say. What are your non-negotiables when you're looking to bring in quality practitioners and talent? And again, it's about communication, but setting the expectations with them so that you know that you can trust those you're positioning in front of the patients who are instilling their trust in you are, everyone's working within good faith. Secondly, I would say consistent standardized protocols. It seems so simple, and it is. Although what I see time and time again is that they aren't followed. You have new practitioners coming in who have done things a certain way, new injectors, business owners really taking pride in setting the standard and expectations for their teams. This is the elite level of patient care that we bring here. And this is what I expect each one of you to be able to provide and fulfill. It's, you're always going to have sometimes dogs you can't teach new and or old tricks to. But at the end of the day, it's very important that practitioners are working in a unified front, because I can say also, I'm hesitant to go see a different injector if they're out on vacation, because I don't know anything about someone else whom they might be trying to fill me in on the schedule with. And then third, follow-up aftercare protocols, I feel like is huge. So Pat spoke about, it's the pre, during, and the post. Post follow-up care is one of the biggest misses, I feel, and it can be so easy. You can automate text messages, emails, put it in the patient's hands to click something that then they call you, so that maybe if you don't want to be the one picking up the phone to call them. But either way, block schedule 30 minutes at the end of your day. If I was a practitioner or injector, I know my dentist even does this after a cavity fill or something of that nature. Just pick up the phone and call, because most times people aren't going to answer. Leave a message, and I'm the patient on the other end, knowing you're going above and beyond, even if it's a text or a voicemail. If I don't choose to respond, it's that level of going above and beyond that you really just don't get other places. So
I love it. That's an amazing list.
One last thing I want to just remember, and this is something that's so big, and we didn't touch on it at all, and not for any reason, but what we hear time and time again at events we go to is how much TikTok and Instagram is affecting the med spa space, and how so many people are actually leaving their trusted med spa maybe to go to another med spa because the trusted med spa won't do a procedure that someone saw on TikTok or on Instagram for whatever reason, safety reasons, whatever the reason. So I guess my big warning out there is, absolutely make it part of your prior history. What was the last spa you were at and when were you there? Because everyone's not going to tell you, oh, I just had a bunch of injections put on my face 10 days ago and now I want more. But they will tell you, oh, I was at this spa 10 days ago. And then if you look and you're worried, you can call that spa and find out what happened, because everybody's bringing their medical history with you. They're just not telling you everything with them.
Completely true, 100%. And I mean, the truth of the matter is, this is probably the least sexy part of this industry, right? This is the homework. This is the practice. Like if you're a professional athlete, you practice and you practice. This is what you have to do to be at the top of the industry, is to do your homework, to do the SOPs, to make sure you know what you're doing, to have the uncomfortable conversations. That's what will actually put you above it all. So thank you so much. People can find you. You are platinum vendor affiliates of AmSpa, so you can always find our vendor affiliates under our resources tab on our website in the vendor directory. If folks don't come through the vendor directory, where else can they find you to chat more about Coverwell?
Yes, they can go to our website, coverwell.co, so .co, not .com. And on there's, in addition to information, there's a button you can click, take literally maybe under a minute to give us a little bit of information, schedule your call, and then you'll have a meeting set and ready to meet with someone on our fabulous team.
Amazing. And if you are an AmSpa member, you've heard this on Medical Spa Insider, we'd love it if you let them know where you heard it as well. So, all right. Well, Pat and Kandis, thank you so much for your time today. It was such a pleasure to learn more. And Pat, I'm so glad that you and your wife are healthy and happy in 2024, and continued health to you guys as well.
Oh, thank you very much. We really appreciate the time you spent with us today. We love AmSpa. And if you guys see us at the next AmSpa convention, come up and say hello.
Absolutely. Amazing. Well, thank you so much. And we appreciate your time.
Thank you.
Thank you for watching the Medical Spa Insider podcast. Please make sure to subscribe to our channel for future videos and podcasts. For more information about the American Med Spa Association, please check our description below.